I think there are several motivations. First is that I'm a doctor, so my profession is to help people, and we are not responsible for where we are born. I like to give a part of my richness, to my wealthy, to people who need it with my profession. And if I go to the Philippines or to another developing country, I go a little bit back to my roots for what I wanted to do, what I have learned. I use my fingers, I use my ears, I use my eyes, and I'm the doctor. This is what I love. We go to the very poor. We provide basic health care for those who cannot afford other health care, and we try to be sustainable. So we teach, we train, we try to implement structures to improve the health of poor people. So we go directly to the villages where people live and where they can walk down from the mountains. We go every day to another village. We have a pharmacy with us, so we try to give medication. We have the essential drugs with us, and what we cannot treat, we try to refer, what's often very complicated. Several times I tried to refer patients to hospital because I thought this is an emergency. This is really a child who is in danger because it's very much malnourished. It has a pneumonia today, there are abscesses, there's fever. But then I have to face that emergency is not like emergency in Germany. So it's difficult. I try to treat as much as I can on the spot locally, train the health worker to look after the patient in the next days. Perhaps we will see a baby today. I hope we will see it again. It was a 11-month-old, very small child, very much devasted, malnutrition, and with infections of the skin, of the scalp, and with fever. I tried to refer it. I said, no, it's really an emergency. You have to go. Your child is in danger. I'm not sure in which condition we will see the child today. The abscesses have improved. The weight has gone down. So she lost again more than 500 grams. So the malnutrition is severe, and the mother, you can see what the mother gives her, the breast, it's not enough. Not enough. She has to be fed with solid food, with high caloric food. Only rails. Yeah, she came with cough, and she came with like wasting syndrome. She came with hemoptysis and no loss of appetite, loss of weight, night sweats. So she feels weak, and this is a major sign of TB, and cough and discharge from coughing. So I give antibiotic for in case it's only a bacterial infection. But we do the DSSM, direct sputum smear microscopy. That means she gives twice sputum today, and we take it to Calapan, stain it, dry it, stain it, and look under the microscope whether we find acid fast bacilli, the germs for TB. And she has to come back next month, and then we might have a result. She might be better. If she is better and the result is negative, it's okay. If she's not better and the result is negative, she will go for a chest X-ray. Yeah, and if it's positive, we treat TB. Primary healthcare is healthcare based on the community responsibility, and this is what would be a very good aim to implement here in the Philippines. We would like to have this impact, to teach, to show them, and not to make them depending from what we do.